Welcome to Inside Talk on Cosmetic Surgery. I'm your host, Ann Guetta, and today we're going to be discussing a bit of a hairy topic, the topic of laser hair removal, with board-certified dermatologist Dr. Tammy Cassis. Hi, Dr. Cassis.
Hello.
Welcome to our show.
Thanks for having me.
Now, Dr. Cassis, tell us about laser hair removal. We've read so much about it, heard so much on the TV. What really is laser hair removal? Describe to us the process.
Laser hair removal is what it sounds like. We're physically using lasers to have reduction in the hair follicles and obviously the hairs.
Okay.
So lasers have been around since for what seems like forever, but in the 1960s were then when they were first discovered for cosmetic use.
Right.
And then in 1983, a technology which is called selective photothermolysis was basically invented, and that allowed us to use laser to target a specific area in the skin, in this case the pigment in the hair follicle, to destroy it but leave the rest of the skin intact. So that was revolutionary for us.
That's great.
So as time has gone by, more and more laser technology has gotten better and better. And the way that it works essentially is that the lasers target the pigment in the hair follicle where the hairs grow essentially.
Right.
When you destroy the hair follicle, you won't grow hair.
Okay.
So it's, there's misconceptions because they talk about permanent reduction of the hair or permanent removal of the hair. You're going to get reduction of the hair. Are you going to completely remove all of the hair? No. That's false expectations of it. But you're going to have at least 75 to 80% total reduction in your hair, and that's pretty great.
That is good, yeah.
And it has to be done in a patient that obviously has pigmented hair, and that's kind of the misconceptions. When we have patients come in for consultations, they always think, oh, it works for blonde hair. It doesn't. It can't work for blonde hair. It doesn't work for red hair. It doesn't work for gray hair. It has to be dark hair.
Okay, that was my question. Who's an appropriate candidate for the laser hair removal?
The ideal candidate is fair complected, obviously dark coarse hair. You're going to get the fastest results, the best results.
Okay.
It can be done in all pigmented skin, from the very fair to the darker skin. Darker skin complexions, they want to have some test spots to make sure that they respond appropriately to the skin, to the laser, essentially.
Okay.
It shouldn't be done in somebody obviously that's pregnant, breastfeeding, on medications that increase their risk of a burn. You need to tell your physician that. Really don't want to have a sunburn or a suntan when you have laser. It makes sense because if you have tan in your skin, whether it be from the natural sunlight, a tanning bed, or even the rub-on tans or the spray-on tans, you are basically producing melanin in the top layers of your skin. And so that allows the laser not to get to the hair follicle where it needs to go. So two things, you're going to waste your money, and then you increase your risk for a side effect.
So is it better to do these treatments, if somebody's going to sign up, there are a series of treatments, right?
Correct.
Is it better to do them in the winter time when we have decreased UV exposure?
Absolutely.
Okay.
I encourage patients not to do it in the summer months. I think it's just smarter. Obviously, people that live in Florida and California, they don't have that break, but it's smarter. You're going to spend less money.
Dr. Cassis, how many treatments normally do patients require, and how far apart are they spaced?
It's really individual to the patient. It depends upon the area that you're doing, their skin type, how dark their hair is. So the very minimum that you would need would be 3 treatments. You can get up to the 12 to 13 treatments depending upon the area, essentially. And we usually have patients come back anywhere from 4 to 6 weeks apart. Okay.
Now, what normally does a series of treatments cost?
Again, it depends upon the area. The smaller the area, minimum it's going to be about $75 to $100. Larger areas on up to the $500, roughly average.
Okay.
With the new laser, the Duet, we really appreciate that laser because you're able to do larger areas, shorter period of time, less pain associated with it.
Okay.
And then it takes less time. The patients really win because we don't have to charge them as much.
Right. Now, are there any side effects or risks associated with this procedure?
You're red after you have it done. If you have a tan, you're obviously going to increase your risk of a burn from the laser itself. It's important that it's done within a board-certified physician's office to decrease those risk factors.
Okay, and any post-procedures, specific care that patients need to be aware of?
They need to stay out of the sun, obviously. It's important for them to wear sunscreen, stay out of the sun, and then try to basically not get a suntan or sunburn.
Dr. Cassis, describe for us what the patient feels during the laser hair removal treatment.
There is some pain associated with it. Obviously, certain areas are more painful than others. So when you're doing the bikini area We usually have patients sit with some numbing cream prior to having the procedure done.
Okay.
The axilla or the underarms, moderate amount of pain. They can sit with some numbing cream or some ice prior to the procedure, and that helps significantly. It just kind of boils down to the patient's personal pain level.
Sure.
When I've had laser hair done in most areas, and I felt like the underarms wasn't that big of a deal, but the bikini was significant.
Okay.
And then obviously with the new laser that we have for the backs, that has, like I said, significantly reduced the pain area because of the wide spot size that we have to use, essentially.
Okay. What are the most common areas that patients come into your office complaining about excess hair and where they want it removed?
It has evolved with time, but obviously upper lip, chin area for women, bikini area, axilla. With men, the chest, the back, the ears are the most common area.
Right.
Toes
Wow.
for women, they don't want to shave their toes anymore, and then legs.
Okay. And after the initial series of treatment, what do patients require in terms of maintenance?
Everybody's a little different, so I can speak from personal experience. I did my underarms probably 6 years ago now, and I need a touch-up right now. So
Oh, wow.
I haven't needed anything for 6 years.
So that's great.
Yeah, it's great, but everybody's going to be different. So, once a year you may have to come in for a touch-up, just a spot treat with it. Sometimes with the backs, you may need a touch-up spot here or there.
Okay, that's great.
Yeah, it's fantastic.
Now, we've talked about who the appropriate candidates are for laser hair removal, and now you've said that light-haired patients are not suitable for this procedure. So what are options for those patients who are lighter complected and need to have excess hair and wanted to get it removed?
Laser hair does not work for light hair, for red hair, for blonde hair.
Okay.
So when women will complain about having the peach fuzz or the light hair on their face, the only really treatment that you have for them, you can do the waxing and the plucking,
Right.
but we do what's something called dermal blading or epidermal leveling, and that's
Okay.
taking off the hair, but then also getting a good exfoliation of the skin, so it's twofold.
Okay.
Then we also encourage patients, for that matter, to start doing a medicine called Vaniqua. And Vaniqua works to decrease the hair growth cycle, so whether it's laser hair or epidermal leveling, you'll have to do less of the procedures, essentially.
And how often do they need to get the epidermal leveling?
Again, it depends, but
Okay.
usually it's 4 to 8 weeks apart, and it looks great right before an event because you get that nice
Right.
glow to your skin, the hair is gone, and so it's really important to do maybe like right before an event.
Now, what do you think is the most important caveat that patients should be aware of when before signing up for a series of laser hair removal treatments?
Well, obviously, I'm biased, but I
Right.
think it's important that it's done in a board-certified physician's office. Obviously, I'm a board-certified dermatologist, so I think a board-certified dermatologist or a board-certified plastic surgeon.
Tell me, Dr. Cassis, about what it takes to become a board-certified dermatologist.
A board-certified dermatologist, you graduate from college, you
Okay.
go to medical school. Medical school is 4 years, and then you do dermatology residency. Residency for dermatology is 4 years. The first year is either internal medicine or pediatrics,
Okay.
followed by 3 years of strictly dermatology. We are the ones with dermatology. I have to go through training. My residency training, I had to know the ins and outs of lasers, how they
Right.
work, the physics behind them. Specifically in our office, between the three of us that do laser hair, we've got over 17 years of experience.
Oh, that's great.
So experience is important, and then make sure it's done in a physician's office, and the physician is on site.
Patients should do the research and ask questions of their doctors.
Absolutely.
And where can patients find out additional information about laser hair removal?
You can go to our website. It's www.cassisderm.com,
Okay.
and it's full of information.
Well, thank you.
Thanks for having me.
Have you ever wondered what it would be like
To have a flatter tummy.
To do something about these wrinkles.
To trim these love handles.
to get rid of these brown spots?
To look younger.
To feel better.
To do something.
To do something
for me.
with Dr. Tammy Cassis and patient Heidi, who's had epidermal leveling on half her face today. Dr. Cassis, tell us about Heidi and what you're going to do to her.
Heidi's had what's called epidermal leveling, or dermal planing is another word that we use for it. And it's for patients that are fighting what we call hypertrichosis, or just hair on their face, essentially.
Okay.
But it's blonde hair, so that's where lasers do not work for that. But we have solutions for it. So we've already done half of Heidi's face, so you can see where she's red, a little bit irritated. And then we're going to go ahead and do the other half of her face. And so Heidi can kind of talk about already, the pain level and what she experienced.
Okay, Heidi, how did it feel when you got the procedure done?
It just feels like scratching. It doesn't. It really doesn't hurt or anything like that. You just kind of feel the blade going across your face, but it's not really any pain at all.
So you can, I'm not sure if you can pick it up, but you can already see the hair's gone on her face here. Now, this isn't permanent. Her hair will come back.
Okay.
We have a prescription medicine called Vanaquah that we encourage patients to do to decrease the hair growth cycle. So she'll have to do less of this as time goes on for her life. But it's twofold. So she gets some exfoliating with epidermal leveling, and then it obviously gets rid of the hair. So the makeup's going to go on much smoother and nicer. Okay,
and how many of the epidermal leveling treatments does she need to have?
She'll do these indefinitely, obviously. So when the hairs are bugging her, it lasts about 8 weeks roughly.
Okay.
And so when they're bugging her, she can come on in and have it done, and if she doesn't have to have it done.
Okay, great. All right, I guess we'll get started then.
All right, so she's going to go ahead and lay back, and Christy's going to get going on it for her. The whole procedure maybe takes, 35, 40 minutes, so you do have to plan for some time. Post-op wise, you're going to be just a little bit red afterwards, but she'll be able to go out tonight and she'll be able to cover it with makeup. And there's really no really aftercare except for just protecting yourself from the sun, essentially.
From the sun, okay.
Yeah. So it's kind of boring to watch, but if you get up close, you can see. You're taking off the top layers of the skin, so you can literally see that they're coming off right there.
So in addition to removing the hair, she also gets skin smoothing benefits.
Right,
So
yeah, exactly.
2-in-1 punch, that's great.
2-in-1, exactly. So this is where we think that this is a little bit better than doing something called microderm abrasion, where microderm is taking off the top layers of the skin, but it's going to leave the hairs behind, essentially.
Right. So this is really an option for patients with lighter hair who could not get the laser hair removal.
Light or dark hair, but obviously with the laser hair not going to work for the light hair. This is the perfect solution for these patients. And so Heidi, how does it feel?
It's just like a scratching. It feels like if someone was running their fingernails across your face.
On a scale of 1 to 10, what do you think?
A 1.
Oh, well, that's hardly any pain at all. That's good. That's good, yeah.
So when she finishes, we'll have her moisturize with some sunscreen, and that will be really about it, all she needs to have done. Yeah.
So really no downtime. That's great.
Absolutely not. And if you have a big event that night, you can still go to that. You might be a little bit more red, but she can easily go and put on her makeup and go about her business.
We're back again with Dr. Cassis and her patient Sean, who's having his 5th treatment today for laser hair removal on his ears. Hi Sean, how are you?
I'm fine, how are you?
Fine, thank you for joining our show today. Tell us, this is your 5th treatment for laser hair removal on your ears. So how have your results been?
They've been very good, I'm very satisfied.
You are? Now what was the pain level like when you had the treatments?
I mean, if you were to scale it on a 1 to 10, I would put it at a 3.
Oh, so not that bad.
No, not bad at all.
You've been very pleased with your results?
Very pleased.
Great. Okay, Dr. Cassis, what do you have to add today?
Well, I mean, Sean obviously didn't like the hair on his ears,
right.
And so when you don't like that laser hair, when it's dark hair, it's going to go. You can use laser hair to do it.
Okay.
And so he's a perfect candidate when he's watching his son.
Okay.
Fair complected, dark hair, you're going to get great results.
Okay.
It's not a one and done treatment. It does take multiple treatment sessions, and most patients tolerate it pretty well.
And how far apart do you schedule the treatments?
About 4 to 5 weeks apart, essentially. And so we're going to treat his ears. This will probably be his last time. He may need some touch-up down the road, years go by type thing.
Great. So you feel great about your treatments?
Very good.
Awesome. Okay, we're going to get started then. Thank
All
you.
right, thank you.
So he needs to wear protective eyewear, so we'll get his goggles on, and then we're actually going to step on out and we'll get going.
All right,
Good
great.
luck.
Thanks.
You're welcome. Now we're going to do the other side. Just want to protect your ear here. That's it.
We're back again with Dr. Cassis and her patient Aaron. Aaron is about to receive his second treatment of laser hair removal on his back. We'll be talking to him about that. Thanks for joining our show, Aaron.
No problem.
Tell us, why did you decide to come in for laser hair removal?
Well, I thought it would be a good change going out to the beach and going on vacation, and I thought just aesthetically it was time to make that change.
Okay, so you're going to be receiving your second treatment today. How did the first treatment feel in terms of pain?
I hardly even noticed it.
Great. Okay, so there was really not a lot of pain involved. So
No, not at all.
you're starting to see results with your treatments?
I am.
Great. Okay, Dr. Cassis?
Okay, so Aaron has had one treatment with it's called the Duet. Duet came out, gosh, it's been maybe 6 months now, specifically with the larger handpiece for large areas. So
Okay.
chest, back, legs. Historically, that's been a little bit more painful, harder to do
Right.
because it just takes so much time. So this is fantastic technology. We're able to do full backs in about 15 to 20 minutes rather than the typical close to half hour, 45-minute treatment.
Wow, that's
And so
great.
that helps with bringing the prices down. So Aaron is nice enough. He is going to take off his shirt so we can see his chest, which has never had any treatment.
Okay.
His back, we've already done one half of his back. We did that yesterday, actually, so you can see what it looks like one day after.
Right.
And then the other half has had one treatment. It was about 4 to 6 weeks ago.
Okay, and the same precautions, he needs to wear sunscreen and
Absolutely.
not tan. Okay.
Absolutely. He's a great candidate. He's fair complected. He's got dark hair.
Okay.
He's smart about the sun, so he will have wonderful results.
Great. Okay, we're going to get started then. Thanks.
Okay, so Aaron is a perfect candidate because he's fair complected. He's had no treatments to his chest, so this is basically his chest and his back were pretty similar.
Okay.
And then Aaron, if you'll turn around for us. Yesterday we were able to do one half of his back just so people could see. So he's had half of his back done yesterday. This is one treatment that he had done 4 to 6 weeks ago. So we will shave this part,
Okay.
and then we'll go ahead and get the treatment started.
Great.
So you can already see with one treatment,
That's
significant
dramatic.
reduction.
Yeah,
Mhm.
real significant reduction.
Okay, we'll get
Okay.
started.
We're here now with Dr. Cassis' nurse, Christy, and patient Aaron. Christy's going to be beginning laser hair removal process on Aaron. Hi, Christy.
Hello.
Now tell us what you're going to be doing today with Aaron.
Well, we have already shaved his back, which is why he's a little red on this side. As
Okay.
we said before, we did the other side of his back yesterday, but
Right.
we're going to do this side today, and it's a little red from the shaving, and we're just going to start the process.
Okay.
All right. You ready, Aaron?
Sure.
All right, here we go. We're just going to work our way over his whole back.
Now, how does talk to us a little bit about how the laser works to remove the hair?
Well, it's not actually doing anything for the hair that's on the surface or has already grown up past the skin. It's actually going to the hair follicle and
Okay.
destroying that follicle so that the hair can't grow back. Now, it does take multiple sessions because when you are going after a hair, it has to be in a certain cycle of its life in order
Okay.
to destroy it, which is one of the main reasons it takes multiple sessions.
Okay, so you need to wait several weeks for the hairs to grow back in different stages to treat them.
Absolutely. How are you doing, Aaron?
Doing great.
Good.
Aaron, describe how you're feeling, how the treatment feels.
Well, you feel just a little tiny tug at your skin, and then that's really it. It doesn't hurt, and you don't really notice too much in the way of pain or anything.
So it's really not uncomfortable.
No, it's really not.
Okay. Great. this is a pretty high-tech laser machine.
It is. It's fairly new.
Okay.
It's just been out for about 6 months, and the handpiece is much larger, so you can do larger areas like the back quicker.
Okay.
Whereas before, it would take quite a long time to do a back, and now you can just go right on through.
Now, is it better to do these treatments in the winter time as opposed to the summertime because of increased UV exposure?
It is, unless the person's really good about the sun,
Okay.
wearing their sunscreen, not laying out in the sun and that kind of thing.
So they have to be real vigilant about that.
Exactly. If they're good about the sun, they can do it any time. But
Okay.
you know, there's so many beach vacations, and
Right.
some people just can't. Still doing okay, Erin?
Doing great.
It's like a relaxing treatment. So how long will he stay red like this after the treatment?
Typically, most people stay red maybe a couple hours. How long were you red after your last treatment on the other half of your back, Erin?
Just a couple hours, 2 or 3 maybe.
Okay.
And that's very typical.
So this is his second treatment. So how many more treatments do you estimate that he's going to need in order to get the results he desires?
An average of, 5, 6, and it's very dependent on the person, but typically around 5 or 6, and he'll be where he wants to be.
Have you ever wondered what it would be like
To have a flatter tummy.
To do something about these wrinkles.
To trim these love handles.
to get rid of these brown spots?
To look younger.
To feel better.
To do something.
To do something for me.
We're back again with Heidi, who's had the second half of her face done with epidermal leveling. Okay, Dr. Cassis, so Heidi's all done now.
So you can see now she's red on both sides, obviously, but she has no hair. So she'll leave. We'll have some sunscreen on her.
Okay.
We leave it up to the patients if they want to do Vanicua. It's prescription strength, so it needs to be purchased in a physician's office, obviously.
Okay.
But it would be something that she would put on at nighttime and to decrease the hair growth cycle. So over time, she'd have to do less of the epidermal leveling if she chose to. So how did it feel?
Feels great. Just, feels
Nice
like
and
I have
smooth.
fresh new skin. It does. It's a nice thing to do at the end of the summer because you can get all the the sun exposed skin off of your face, and
Great.
it's great. Yeah.
She'll really appreciate it when she puts on her makeup. It'll just
Right.
be just
Very
a
smooth.
fresh, very smooth skin. Exactly. Okay,
Okay.
so we'll see you in about 4 to 8 weeks when you need us.
Okay.
Thanks, Heidi.
Thanks.
Okay, Sean, so you're finished with your treatment now. How was it?
It was almost painless. It
Good.
was no problem at all.
So you're going to continue to get treatments as needed?
As needed. It's nice to wake up in the morning and just shave my face and not have to worry about my ears.
Great. That's
Yeah.
good to hear. Any post-care instructions for him?
We'll encourage him to wear sunscreens, but he's good to go.
Great. Thank you, Sean.
Thank you.
We're back again with Dr. Cassis and patient Aaron. Aaron's just completed his treatment. Dr. Cassis?
This is a very typical response, so it's important to see, obviously, this side has been done.
Right.
The redness, the erythema, that will go away in a couple of hours, really, maybe a day.
Okay.
It's important that he has sunscreen on and he's ready to go.
Great. And then he'll come back for another treatment in another 4 to 5 weeks?
4 to 5 weeks, essentially, yep. And it's always best, obviously, we have to shave the areas that we're going to treat. You'll get a better result if you do that.
Right.
So just to speed up, we encourage patients to, if they can, shave before they come in to have their treatment. But if they can't, it's not that big of a deal.
Okay, sounds great. Thank you.
Thank you.
We'll be back in a moment with a recap of our show today.
Have you ever wondered what it would be like
To have a flatter tummy.
To do something about these wrinkles.
To trim these love handles.
to get rid of these brown spots?
To look younger.
To feel better.
To do something.
To do something for me.
For a recap of our show today, keep the following main points in mind. Number 1, make sure that your physician is either a board-certified dermatologist or plastic surgeon, and check that they have the appropriate training and experience with laser hair removal. Always make sure a physician is on site when signing up for a series of laser hair removal treatments. Number 2, inform your physician of any medications, alcohol, tobacco use, or vitamin supplements, as well as any special medical conditions before undergoing any laser hair removal treatments to avoid any complications and ensure the safest and best possible outcome. Number 3, remember that laser hair removal requires multiple treatments to see optimal results. And finally, number 4, patient cooperation is essential for the success of laser hair removal. Patients need to explicitly follow directions with regards to avoiding tanning and wearing an SPF of at least 30 on the treated areas. Thank you for watching this edition of Inside Talk. Please join us next time as we explore more exciting topics in the field of cosmetic enhancement. We'll see you soon.
Have you ever wondered what it would be like
To have a flatter tummy.
To do something about these wrinkles.
To trim these love handles.
to get rid of these brown spots?
To look younger.
To feel better.
To do something.
To do something for me.
Hi, I'm Police Chief Robert White. With more bicycles on the road, it is important that everyone knows the rules. Remember that cyclists have the same rights as other vehicles in Louisville. Motorists should yield to cyclists when turning. Don't cut off cyclists. Slow down and give a cyclist at least 3 feet when passing. Never honk at a cyclist, it could cause them to crash. And always check for cyclists before opening your car door.
Let's all use our street sense in Louisville.